As far as, how can I say it, PTSD groups, the one I experienced was not very pleasurable. I'm hesitant to go back. I haven't been back in the system for over 8 months. I basically deal with everything on my own. As far as traumatic brain injury, I had 3 major incidences over in the Middle East. I still need to be diagnosed for that. There's a lot of stuff going on with me because I was a forward deployed engineer, and it wasn't nice.
My name is Jenny Plim. I'm a licensed massage therapist and craniosacral therapist, and I've been doing this work since 2004. The veterans we've seen come to us with a variety of symptoms, everything from depression, anxiety, how to deal with anger. Some have sleep disturbances, some have difficulty concentrating, some have residual symptoms they're dealing with as a result of traumatic brain injury, and then there's physical pain. That's the clinical side of things. On the personal, emotional side of things, they're asking questions like, what could I have done to make it better? Or what's my life for now? You know, how do I integrate back into the life I used to have? When you're protecting yourself emotionally, there's a guarding that happens in the body. And some of the techniques in this work release those restrictions that result from that physical guarding of the body. As a result, we often hear people say things like, oh, I feel like a huge weight has been lifted. You know, what was tight and held and guarded and heavy is now released, so they feel free and lighter and like a huge weight has been lifted.
I was just in awe of what was happening like inside of my body, and just and like that type of release of like I've never had like a sensation like that before. It was really good.
Craniosacral therapy is a gentle, hands-on, whole-body evaluation and treatment that releases restrictions around the brain and the spinal cord. That allows the central nervous system to come into balance and the body to self-correct. All the techniques are very gentle. We use about 5 grams of pressure. The idea being that we want to meld with the tissue and the body and the client the way the person is, so as not to induce the kind of guarding and startle response. You know, we meet people where they are, we listen to the rhythm, we listen to where their tissues want to move and facilitate that movement. Out of that process, things are released and results happen.
I slept through the night for the first time. I have literally no pain in my body for the first time in almost 3 years. I slept so soundly. When I woke up this morning, I'm like, wow, this is pretty good. I'm looking forward to session 2, 3, and 4.